ನನಗೆ ನಾನೇ ಏನು ಮಾತಾಡ್ತೀನೋ ಅವಾಗ ಏನು ಮಾಡ್ತಾನೋ ನನಗೆ ಗೊತ್ತಾಗಲ್ಲ. ಹೊಡೆಯೋದು ಜಾಸ್ತಿ, ಜಗಳ ಮಾಡೋದು ಜಾಸ್ತಿ, ಕಂಟ್ರೋಲೇ ಆಗಲ್ಲ.
We were also quite ashamed to admit it openly. So, for instance, if guests come home, we would try to keep my mother away.
We also went to a tantric who fleeced us and nothing happened.
My family has neglected me so much that now I've come to the idea that I have to think of my own life.
In a country with nearly 70 million Indians suffering from mental disorders, there are only less than 4,000 registered psychiatrists.
The gap as it exists today in terms of psychiatry-led services for India, that gap is going to take a very long time to fill. This is not going to be achieved in a hurry by any stretch of imagination. Having said that, there's been a decided push towards increasing the number of postgraduate centers in a variety of medical colleges around the country.
Conflicted with the trauma most people do not understand, these people can either choose to lead chaotic lives or be allowed to play their part in society and not be shunned or discriminated.
People with severe mental disorders have a great need for treatment continuously for long periods of time. About 2/3 of this population would need treatment, help, rehabilitation going on for many years, and they need help from mental health services in the country.
The Richmond Fellowship Society India, a registered charitable NGO, provides rehabilitation services to persons with severe mental illness. The fellowship offers a supportive and secure home environment for these people. RFS first made its entry in India in 1984, when Elly Jansen, a social worker from UK, began groundwork to establish it in the country.
So when she visited Bangalore, she met us at NIMHANS. She was probably impressed that at NIMHANS we had already started the rehabilitation program not only for the inmates of the hospital but also for those who have been discharged. She met some of the members of the rehabilitation committee. She went through the thing, and probably this was the reason why she chose Bangalore to start the first halfway home.
Richmond Fellowship was established in 1986, at a time when rehabilitation facilities for persons with mental illness were still inadequate. Its founding was truly a landmark moment in the field of psychosocial rehabilitation.
A lot of people do not realize that if they have offspring or relatives who are mentally ill, that something can be done and that the stigma can be overcome. That you can, for example, even start self-help groups the moment that you have a few people who have begun to understand, how to get together to make provision for people. This kind of work, part of it is very expert, and you need to train staff, and that could actually be done in much greater quantities.
Our main emphasis has been to intervene at the right time, to give early intervention, both in terms of medication, pharmacotherapy, as well as psychosocial support.
With over 30 branches situated around the world, RFS India has truly made its mark, with Elly Jansen calling it the jewel in the crown among the other fellowship societies. With centers located at Bangalore, Delhi, Lucknow, its metropolitan branches, and Sidlaghatta and Ramanagara, the rural branches, RFS has adopted a multi-pronged approach to treating chronic mental illness. Halfway homes, long stay homes, daycare centers, along with vocational training and community-based rehabilitation activities in the rural areas.
Rehabilitation is about physiotherapy for the mind, for your recovery of your various skills that you have lost. The illness, the longer it remains in the system, it slowly erodes into different components of our living system. It destroys different living skills that we have. We provide a comprehensive rehabilitation program which addresses the individual needs, the needs of the family, needs of both the individual and family together, so that the ultimate goal of them getting integrated back into the society is very important.
Daycare centers like Chetna in Bangalore and Udaya in Lucknow facilitate various vocational training activities. Some clients are paid a small incentive for the various works that they bring out, instilling in them a sense of financial independence and self-worth. Clients are trained in various aspects of day-to-day living while paying attention to their mental health and well-being.
We say that simply giving medicine to a mental illness is not the cure. We have to have counseling, and we have to have the support of caregivers, the family, as well as the society.
Our main objectives was first to increase the awareness regarding mental illness, removal of stigma, start a facility like daycare center where we can do rehabilitation of patients, and to increase awareness we are doing various activities.
One of Richmond Fellowship's most successful model is the halfway home. Asha, located at Bangalore, and Vishwas at Delhi, aims at reintegrating people with mental illness back into the community with the assistance of technically adept and trained staff, along with the support given by family members. The halfway home strives to create an environment to assist residents to become more independent and self-reliant.
Patients who have sufficiently recovered from the acute illness, they live in a community setting with other recovering patients, and they are again taught the skills of daily living, and this is done in a very gradual manner and in a very non-judgmental fashion, and at the same time they are provided enough support and enough skills so that once they are able to handle the demands of life without feeling the stress, then we advise them to go back to their families, to go back to their jobs.
Jyoti at Bangalore is a long-stay home for people with chronic mental illness. Residents stay here for an indeterminate period of time, as familial circumstances do not permit them to stay with their families. Residents are provided with an opportunity to showcase their talent through a boutique selling artwork they create. Jyoti is truly a home away from home for these people.
The basic criteria for residents coming into Jyoti is a stay at the halfway home, that is Asha. So after they undergo a training, rehabilitation training program there, they are admitted into Jyoti if the families wish to continue them. And we encourage independent living. We don't have a specific time period duration for them to be discharged from this.
Through its activities at Sidlagata, RFS aims to reach out to the rural population by providing free consultation and medicines twice a month.
ಇಲ್ಲಿ ಕೊಡೋ ಫ್ರೀ ಮೆಡಿಸಿನ್ಸ್ ಇಂದ ನಮ್ಮವ್ರಿಗೆ ತುಂಬಾ ನಮಗೆ ನಮ್ಮ ಫ್ಯಾಮಿಲಿಗೆ ತುಂಬಾನೇ ಹೆಲ್ಪ್ ಆಗಿದೆ.
The program is going on very fine, and all the colleagues and other members of the RFS are doing very valuable service to this RFS, and it is a service to the cause of the society.
About 400 patients from in and around the village and nearby taluks avail these services.
ಚೆನ್ನಾಗಿ ನೋಡ್ತಾರೆ, ಅವರು ಭಾಳ ಕೌನ್ಸಿಲಿಂಗ್ ಚೆನ್ನಾಗಿ ಮಾಡ್ತಾರೆ, ಅವರ ಎಲ್ಲ ಪ್ರಾಬ್ಲಮ್ ಎಲ್ಲ ಕೇಳ್ತಾರೆ, ಹೆಂಗಿದೆ ಏನಾಗಿದೆ ಇನ್ನೂ ಹೆಂಗೆ ಇಂಪ್ರೂವ್ಮೆಂಟ್ ಮಾಡ್ಬೇಕಂತ ಹೇಳ್ತಾರೆ.
This has done a yeoman service to the rural community. Otherwise most of the people from here had to go a long way to Bangalore.
At the Sidlagata branch, RFS runs a daycare center, Pragati, enabling various vocational training activities suitable to the local employability opportunities.
In Richmond Fellowship, what I have learned is that we have got a batch of students who come here and take treatment. They take a lot of experiences from here. They will go and they will have a lot of, they can remove the stigma as well as give treatment to these people.
And there is very good coordination between the people who work here. The staff is quite sufficient and personal care is given to each patient. That is the most important thing which I have noticed in the Richmond Fellowship of Sidlagata.
Ramnagra, a relatively new project of RFS, aims at establishing a similar kind of support program to the rural community in that area.
ಈ ಕ್ಯಾಂಪ್ಗಳಲ್ಲಿ ಪ್ರಾರಂಭದಲ್ಲಿ ಹೆಚ್ಚಾಗಿ ನಮ್ಮ ರಾಮನಗರ ತಾಲೂಕಿನ ಬರ್ತಾಯಿದ್ರು. ಬರ್ತಾ ಈ ಕ್ಯಾಂಪ್ ಚೆನ್ನಾಗಿದೆ ಮತ್ತು ಈ ಕ್ಯಾಂಪಿಂದ ನಮಗೆ ಅನುಕೂಲ ಆಗ್ತಾಯಿದೆ ಅಂಥೇಳಿ ದೂರದಿಂದ ಕೂಡ ಈ ರೋಗಿಗಳು ಬರಲಿಕ್ಕೆ ಪ್ರಾರಂಭವಾದರು.
This is Ramagiri. We have 2 acres of land and we are building Nemmadi Manasika Arogya Unnata Kendra, a higher center for mental health. We are going to build half a home with initially for 30 patients.
At RFS, halfway and long stay homes are centrally located and in prime residential areas. They believe enabling maximum interaction with neighbors could help reduce stigma. The homes are also designed and selected based on safety and comfort of its inmates.
This building has been custom designed. It has some very special features which have come as a result of our consultations with the mental health professionals, our experienced staff and architects who had designed many hospitals.
Every client has a tailor-made therapeutic treatment plan to enable quicker reintegration back into society.
Person that comes here may have the same diagnosis, the symptoms may be the same, but each individual is different. So the backgrounds are different. What would be a good rehab plan and activities for this client X as compared to client Y? So in that sense, having an individual tailor-made rehab plan becomes very effective, and that's what we try and focus on with our clients here.
It would be cliched to say mental health has long been ignored in India. Social stigma and ignorance have marginalized victims of mental health to the point of non-existence.
Still large number of people try to go to religious places in the hope of securing treatment for these illnesses, which often is counterproductive. Our motto is dare to care. RFS has developed in this country with hardly any assistance from any government agencies. The way ahead is bumpy, difficult, but achievable.
The era of blaming the families is thankfully improving, even though there is still a lot of wrong attitudes and false understanding of this illness among the public. A good deal of stigmatization still happens. And the way ahead to minimize that is public education, education about mental health in schools, as well as family education as part of the treatment intervention for our patients.
Sensing the need for trained professionals in psychosocial rehabilitation, Richmond Fellowship has diversified into academics. It offers a 2-year full-time postgraduate course in psychosocial rehabilitation and counseling that is approved by the Karnataka government and affiliated to Rajiv Gandhi University of Health Sciences. In addition, the college also runs 3-month short-term courses, each in psychiatric rehabilitation and counseling. An important facet of the curriculum is yoga, which helps in personal growth and understanding the psyche. This exceptional model makes RFS a one-of-its-kind institution in the whole of Southeast Asia.
We started short-term training programs, not only for people who were working at RFS, but also it was open to other people who would go out after the training and start their own centers or work other places. So that's how the short-term training program was going on. And during that period, they trained about 50 to 55 people like that. But at the same time, it was felt that it should be more formal. The short-term training programs are not sufficient. And that was the time when the thought of starting an MSc program in psychosocial rehabilitation was mooted. The students here are posted in our various facilities where they get hands-on training. They work with the clients over there, residents over there, and learn the skills of rehabilitation.
The team at RFS is widely involved in advocating the rights of persons with mental illness and creating public awareness. The fellowship currently has a few ongoing projects addressing stigma and rehabilitation needs in rural and urban India.
The important project that has been now going on is a funded project from the Indian Council of Medical Research. This project was started in December last year, and the project is comparative study to assess the quality of life and rehabilitation needs amongst the elderly persons with mental illness and in rural and urban areas.
But the journey hasn't always been easy. The fellowship has had to face a lot of challenges, especially in the form of unavailability of funds.
The major challenge for us is the non-availability of government funds, although on paper it is supposed to be available, but we have not been able to get despite our best efforts in the last many years. So the big challenge is the financial aspect of this, running the facilities and our programs.
Mental health is an area that is not recognized or accepted by the mainstream community. So Richmond Fellowship has a real challenge in how to raise awareness about this issue, how to get the policymakers, the government, the donors and the community involved in knowing about this issue and taking it forward.
It is a harrowing experience to live with this illness, and Richmond Fellowship Society, in its Silver Jubilee year, has aptly chosen the theme Rediscovering Dignity.
As the disease progresses, the dignity of the individual which is shattered completely gets lost. Their self-worth, their very core of their being seems to get eroded. The process of treatment, the beginning of the treatment, the long duration of treatment, the correct medication and the maintenance treatment along with appropriate rehabilitation measures begin to restore their dignity in a slow process.
State of civilization depends how well do we care for the weakest member of our society, and the mentally ill are the weakest member, and our level of civilization would only be decided by the way we care for our mentally ill.
RFS, through its rehabilitation centers, has succeeded in alleviating the lives of many and enabled them to lead productive and dignified lives. Today, it has become a home to many.
They look after us very well. We don't have to bother too much about our other daily work which we do normally when we are not in a place like this. They slowly teach you to do it yourself, and we have to do these things ourselves and then become independent and get into the regular stream of life as a normal person, which I think, ready to do.
Here she is getting that feeling of belonging, which she might miss out at home.
Started building another kind of family, another new family that I became a part of.
I had a lot of improvement at Asha, given whatever routine they used to follow.
and also the counseling, whatever I got from the staff here.
I cannot stay alone now. That is why I live here.
She wanted that motherly care and a friend, all that, and she got that here.
Thoroughly enjoying my life and all thanks to RFS.
ಇಲ್ಲಿ ಚೆನ್ನಾಗಿ ನೋಡ್ತಾ ಇದ್ದಾರೆ ಡಾಕ್ಟ್ರುಗಳೆಲ್ಲ, ಭಾರಿ ಸೌಲಭ್ಯ ಮತ್ತು ನನ್ನ ಕಲೆಗೆ ಇಂಪ್ರೂವ್ಮೆಂಟ್ ಆಗಿ ಮಾಡ್ತಾ ಇದ್ದಾರೆ. ದಯವಿಟ್ಟು ಅವ್ರಿಗೆ ನಾನು ಕೃತಜ್ಞನಾಗಿರ್ತೀನಿ.